Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's discussion is osteoporosis, vitamin D deficiency, and calcium supplements. Osteoporosis is a frightening disease. Oftentimes it affects women in their postmenopausal years, but it can affect men and in certain medical conditions affect anyone at an earlier age. Osteoporosis literally means thin bones in Greek. It is caused by a lack of calcium in the bones, which make them weak and brittle and more likely to break. Fractures caused by osteoporosis can present in a variety of ways. It can be as something simple like a wrist fracture as you fall and brace yourself. It can be a compression fracture of your spine associated with a fall or very minor trauma. Or the most serious fracture could be a hip fracture, which, especially in the elderly, can lead to death. So what are the factors that lead to osteoporosis? Osteoporosis becomes more common as we age. So age is certainly an important risk factor. Other risk factors include a family history of osteoporosis, especially if you have what we call a first-degree relative with the condition, a mother, a sister, puts you at higher risk. Also, if you are Caucasian or Asian, you have a higher incidence of osteoporosis. And if you smoke or have a thin build, then you also have an increased risk for developing osteoporosis. Osteoporosis really gets back to the amount of calcium in your bones. This is where vitamin D comes in, because your body cannot absorb calcium properly unless you have an adequate amount of vitamin D in your diet. Now, vitamin D is an interesting vitamin. It's probably the only vitamin that your body can manufacture on its own. All that is needed is sunlight. If you have adequate sunlight, chances are you're going to have enough vitamin D made by your body. It's kind of a double-edged sword though, because we've been told wear sunscreen, cover up, don't expose your skin, especially to that ultraviolet radiation, because it can cause skin problems, premature aging, as well as cancer. This may be why many people are vitamin D deficient. We've taken the dermatologist's advice and we cover up and wear sunscreen, but in the process we may not be able to make enough vitamin D. Now, it's been estimated that especially in the months where we have strong sunlight, in the spring and the summer, that if you were out and had full skin exposure or good skin exposure from sunlight for as little as 20 minutes a day, your body can manufacture enough vitamin D to meet your requirements. Unfortunately, in the winter months, we're not exposed to this strong level of sunlight, and also in the summer months, we're wearing sunscreen and covering our skin up to help prevent that sun damage. The recommended daily allowance of vitamin D is expressed in a unit called international units. It's not milligrams, as is the case with most other vitamins. Now, it used to be we thought that 400 international units a day was adequate for an adult. Turns out that was woefully inadequate. Most experts now are recommending that you get at least 1,000 international units of vitamin D every day. It sounds like a lot, but don't worry, it's almost impossible to overdose from vitamin D. You'd have to take doses of 50,000 international units a day to be at risk to overdose on this essential vitamin. Other preventative measures to help prevent the osteoporosis would include getting adequate calcium in your diet. Now, for the average adult, the recommended daily allowance of calcium is 1,200 milligrams. Calcium supplements come in a variety of forms. There's calcium carbonate, or Tums. There's also calcium gluconate, calcium citrate, so you have a variety of choices here. Probably the easiest form of calcium for your body to absorb is calcium citrate. Sometimes this form of calcium is put into orange juice, but you can also buy it in a tablet form. The advantage of calcium citrate is it does not require stomach acid in order to be absorbed by your body in the intestine. It can be absorbed directly. Whereas calcium carbonate, or oyster shell calcium, requires acid in the stomach in order to be absorbed. This can be a factor, especially if you're taking any medicines to reduce stomach acid, like Zantac or Prilosec. Another way to help reduce your risk of osteoporosis is regular weight-bearing exercise. When we exercise, it puts a stress and a strain upon our skeletal system, and the bones respond by becoming stronger and less likely to break. These preventive measures are especially important for women in their 30s because it's in these early decades that bone is deposited, or calcium is deposited, into the bone bank. Later on in life, as your bones thin, you have more to draw from before you develop osteoporosis. So it is critical for a woman in her 30s to engage in regular weight-bearing exercise, getting adequate amounts of vitamin D and adequate amounts of calcium. Thankfully, a lot of the calcium supplements now come with the USDA recommended amount of vitamin D, that 1,000 international units. So in summary, the best way to prevent osteoporosis is to take the 1,200 milligrams of calcium a day, the 1,000 international units of vitamin D, regular weight-bearing exercise, and if you smoke, quit. This has been Dr. Tim Moser with MedNotes. Until next time, I wish you the best in health and prosperity. Take care.